If you're watching this video, I know that you're not just losing hair, you're losing a part of yourself. So see these 10 results, these 10 hair transplant results, and make a note of what distinguishes them from natural hair patterns. Today I'm going to show you how to differentiate natural looking hair transplant results that sustain, retain themselves in the long term. And I'm going to give you some homework this time. And after you've analyzed these results and jotted down your points in the comment section below, the components you think are required for a natural hair transplant result, what you expect from a hair transplant, I will give you a checklist, a complete checklist, what to check for a hair transplant result that is sustainable, long-lasting. So hang on. In hair transplantation, naturalness is just not about how many grafts you got. It's about how well they blend with your face, your age, and your distinct personality. A good hair transplant should be invisible. The hairline shouldn't scream surgery. On the other hand, it should gently whisper youth. Angle, direction, density, and design. Each graft that is placed is like a brush stroke on a canvas. And your donor area, that's your biological currency. So spend it wisely. The evolution of hair transplant surgery from the archaic old-time plug era to today's nuanced follicular unit-based procedures has mirrored a broader shift in the ethos of aesthetic surgical hair restoration, from quantity to quality, and from the surgeon's satisfaction to the patient's empowerment. In a world increasingly driven by visual gratification and instantaneous results, it becomes imperative for both patients and surgeons alike to align expectations with biological reality and the artistic possibilities of surgical hair restoration. So today's topic seeks to illuminate the characteristics of an ideal hair transplant result, the biological timeline of its evolution, and the myriad variables that determine satisfaction, that determine disappointment, that determine delight. Defining success in hair transplant surgery is akin to defining beauty, because beauty is context specific, beauty is subjective, beauty is deeply tied to perception. Yet in clinical practice, certain criteria universally distinguish excellence from mediocrity. Naturalness of hair design, harmony with facial morphology, appropriate density distribution, seamless donor site healing, and long-term viability of transplanted follicles are all measurable metrics of a good outcome. However, it is equally important to consider the intangibles of surgical hair restoration and its results. The patient's psychological restoration, regained self-esteem, and freedom from concealment behaviors like wearing a cap or sprinkling a powder. When the hairline becomes undetectable and your transplant ceases to be a topic of discussion, when you spend less hours looking at yourself in the mirror or avoiding it completely, one can safely say that your surgery has succeeded. After all, the best surgery is the one which nobody notices. Your barber even can't tell. Because naturalness in hair transplant is non-negotiable. Patients today increasingly are not merely content with getting more hair. They demand hair that appears indistinguishable from nature's design. And achieving this result, this outcome, can only be done through meticulous surgical planning and respect to anatomy. Hair does not grow in straight lines or in geometrical patterns. It exhibits variations in density, in direction, in angulation. The anterior hairline in particular must be feathered and irregular. There should be a transition point. Avoiding any semblance of symmetry or uniformity, the transition zone, that is the first few millimeters behind the frontal hairline, must consist exclusively of single hair grafts, spaced with deliberate irregularity, macro irregularities, micro irregularities, to mimic the soft, wispy look of a natural hairline. The area behind this transition zone can house multi-hair grafts, but the illusion of density must never compromise authenticity or naturalness. The angles of implantation matter profoundly. Hair that grows perpendicular to the scalp is bound to appear erect, is bound to appear unnatural, especially in the frontal and the temporal areas. However, hair that exits at an acute angle relative to the scalp conforms with the natural flow and allows for easier styling. The crown or vertex present its own challenges, which are pretty unique, requiring a centripetal pattern of implantation conforming to the patient's native vole. A misaligned swirl pattern in the crown area can be a glaring giveaway, as the eye, even the untrained eye, subconsciously is programmed to detect deviations from expected anatomical natural patterns. This is artistry grounded in anatomy, what one might call biosculpture. Density, though often used as a yardstick by patients, is often a misleading metric when taken in isolation. A natural scalp has about 80 to 100 follicle units per square centimeter in the frontal zone. However, modern hair transplantation techniques, even with the densest of packing, typically can achieve only 35 to 65 follicle units per centimeter square. It is clear, therefore, that transplant surgery does not aim to replicate natural density, but to simulate it through visual illusion alone. And several factors contribute to this illusion. Hair shaft diameter is more important than hair count. A patient with coarse black hair on pale skin may appear to have greater density than a patient with fine, light-colored hair, even with fewer grafts. And then, very importantly, the direction of hair growth influences the casting of shadows, shadow casting, and therefore the perception of thickness, a visual illusion. More importantly, a well-distributed placement of follicle units that avoid gaps, follows natural growth angles, and respects the existing hair pattern can fool even a trained observer like your barber. Moreover, one must be judicious about graft greed, both on the part of the doctor as well as the patient, because overpacking with grafts can compromise vascularity, the blood supply. And this is particularly so in redo revision cases and results in graft death and suboptimal outcomes. In the crown area, where the area is large and the expectations from a hair transplant are even larger, unrealistic, the surgeon must educate the patient that complete coverage to the patient's entire satisfaction is a pipe dream. But cosmetic improvement is a reality. Here, as in many domains of cosmetic surgery, less is more. The hairline is more than a border. It is a visual cornerstone of the face, and therefore its design should be guided by your age, your facial structure, degree of hair loss, future balding patterns, and the availability of graft donors. A youthful patient may desire a low, straight hairline reminiscent of his youthful days, his adolescence. But such demands must be tempered with foresight. A hairline that is too low, a hairline that is too flat may appear satisfactory for a few years, but with time, with recession in the temple areas and progression of baldness elsewhere, this will become incongruous, like an island adrift, a part of an iceberg that is broken off and is going into the ocean, separated. Aging gracefully is the hallmark of a good hair transplant. Therefore, the hairline should be placed conservatively with an eye towards future progression. The use of the last wrinkle crease, the forehead to hairline ratio, Michelangelo's facial thirds, the rule of golden proportion can aid in guiding hairline design in an objective manner. And gender differences must be respected. Women generally have more rounded anterior hairlines, heart-shaped hairlines with preserved temporal points, hairlines not distinguishable from the temporal points, whereas men tend to exhibit recession in these areas and develop a male pattern, M pattern, which is normal. And this need not be corrected. And then the temporal reconstruction is a subspecialized art. Incorrect angulation or placement of the temporal peak can feminize the male face and create complete disharmony. The hairline must also harmonize with the temples. After all, one cannot only paint the frame and ignore the corners of the canvas. Ultimately, the hairline is the patient's signature. It speaks of both aesthetic judgment and technical precision. And like any great signature, it should be memorable without being flashy like Donald Trump's signature. And if the recipient area is the beneficiary, the donor area is the bank. One cannot spend indiscriminately from a finite reservoir. The average donor density varies between 60 to 100 follicle units per centimeter square. But not all of this can be harvested at once. Many clinics try to do that and cause overharvesting and shock loss and scarring visible from a mile. A maximum safe extraction density is often 15 to 20 follicle units per centimeter square. That is about 1:5 ratio. But this also depends upon the donor size, donor density, hair characteristics, previous surgery, and the patient's objectives. Overharvesting, as we all know, can lead to visible depletion, especially in FUE. And the moth-eaten appearance that results is impossible to treat and creates a greater aesthetic concern than baldness itself does. Diffuse thinning of the donor region, sometimes even in retrograde alopecia or dupa, can further limit harvesting. Surgeons must be adept at identifying these patterns preoperatively through dermoscopy, trichoscopy. Furthermore, donor management should consider future needs. A 30-year-old with Norwood grade 3 might progress to grade 6 or grade 7 over time. So if the donor area is not respected and is depleted in early years to satisfy graft greed, both of the doctor and the patient, there will be very little left for future correction. The principle of do no harm applies here with even greater urgency. And at the heart of every procedure lies the human element, which should not be missed. Patients desiring hair transplants often carry deep emotional scars, loss of confidence, feeling of unattractiveness, and social withdrawal. And their expectations might be shaped by celebrity results, use of filters in Instagram, Snapchat, and of course online marketing. It is therefore the surgeon's moral responsibility to educate and to enable. Surgery should never be offered to patients with active body dysmorphia, nor to those with unrealistic, irrational demands. The ability to say no is often a greater virtue than the capacity to operate. A good hair transplant should age gracefully. As the patient grows older, the hairline should maintain its relevance. It should blend with the evolving anatomy rather than stand out like a relic. The patient should grow into the hairline as he ages and not grow out of, and scar visibility should remain minimal. Donor depletion should not restrict future revisions and future plantation as baldness progresses. The patient should be able to style his hair freely without strategic combing or concealment. And more importantly, they should forget they ever had a hair transplant done, for the best outcomes become unremarkable in their normalcy. In the long term, it is not the number of grafts, not the price tag or the trend that matters. It is the comfort the patient feels when they look in the mirror. And a good hair transplant restores more than hair, it restores your identity. So to end, a hair transplant, when executed with artistic sensitivity, anatomical precision, and ethical restraint, offers one of the most profoundly gratifying outcomes in all of aesthetic surgery. And it requires the doctor to be a scientist, an artist, and a counselor with empathy. And for the patient, it demands patience, realism, and trust. While the journey may be long and arduous, and the road uneven and the ride bumpy, the destination, when reached right, is worth every mile. So thank you for watching again. If you have any questions, please pen them in the comment section below and I'll respond to them in due course. But if you're seeking any personal consultation for your hair transplant surgery, contact us on the numbers given above and we'll get back to you shortly. Have a nice day and God bless you.